It can feel very defeating. I feel like the mental health aspect is probably what brings me down the most of just like here we go again, another flare, and stress is a really big trigger for me, so it's almost cyclical of like now I'm stressed about the flare. So that's tough. Hi, I'm Victoria. I go by Fly for Ginger online as a content creator and social media manager. I live in San Diego, California, and deal with psoriasis, which I was diagnosed with in 2010. The first word that comes to mind is frustrating. I think because it can be difficult to find the right treatment since we're all so different. Thankfully, there are a lot of options out there, but it has been a long journey of finding what works for me. And then because it is autoimmune, you sometimes have to change the treatments. So, honestly, in a word, frustrating, but thankful. I want to say middle school. I had the pain in the back of my scalp, right where there that fold is, and it was like cracked open, and it would hurt so bad. And there was some kind of solution that my dermatologist gave me, and it hurt, it stung, and so of course I didn't use it all the time, and that was kind of like the biggest problem for a long time. And then I want to say at the end of high school, early college. 2010 time, I was having issues with inflammation in my foot, on the top of my foot, a lot of pain. And that's what led to my psoriasis diagnosis. Funny enough, because you deal with inflammation inside of your body that can manifest in psoriatic arthritis, which I have. And so that's kind of when the journey of finding treatments that work for all of the things, not just my skin, but the inflammation in my body started. So yeah, funny enough, like a bump on the top of my foot in 2010 is kind of what kicked off this 15-year journey. I think visually, the dermatologist was able to identify that it was plaque psoriasis just by looking at. I was starting to get some creeping down my forehead onto my face, and that's when they could visually see the skin issues. And then also understanding that it manifests in psoriatic arthritis as well. But then where the frustrating part comes in is they sent me to a rheumatologist who said there's nothing wrong with you, you don't have arthritis, and it's like a little bit more complicated than just whatever they can see in a blood test for arthritis. So and that's kind of like my medical story all over with all the things that I deal with is like you have a problem and then I try and solve the problem and then a specialist says you don't have a problem. So it's like it's very difficult, but the actual diagnosis of plaque psoriasis that never changed, and so working on that has been a consistent struggle of like here's a shampoo, here's a cream, here's an injection, here's a pill. So like again, thankful that there are so many different options, but it can be kind of whack-a-mole with figuring out what works. It can be hard to feel empowered enough to talk to someone you feel does know more than you, but the things that you're being told, they just don't feel right. Like your own body better than they do. So it's kind of like that balance of I know you're a professional and like scientifically what you're talking about, but internally I know what I feel like and what you're telling me it just doesn't match. So getting another opinion, seeing someone else is very important. I remember I was seeing a dermatologist at one point who felt so bad that he wasn't able to help me. And the next treatment option was to do injections under each and every plaque that I had. And it was going to be $60 per injection and like, I have a pretty intense case of psoriasis, especially when I went to see him. And he was like, I'm just going to charge you $60 and do like all these injections. And it just felt like, there's no way that this is the last option that I have. There's no way that for the rest of my life, the only way I can get a handle on this is an injection under every single plaque. It was bananas. So, I saw another dermatologist and off we went to other kind of treatment options. It can feel very defeating. I feel like the mental health aspect is probably what brings me down the most of just like here we go again, another flare, and stress is a really big trigger for me, so it's almost cyclical of like now I'm stressed about the flare. So that's tough. And also being a content creator, I show my face online, and that can be really intimidating because I flare on my face. I get it all over my forehead, sometimes on my cheeks, and it can be difficult when it's like really raw. I can't put makeup on it, to protect my skin. So, one thing that has helped a lot is actually talking about the psoriasis and showing up like raw, unedited, without makeup, and just being like, yep, here's another flare. And we kind of all moan and groan about it together and kind of have a community where we all get to talk about our skin issues and how tough it is. So, it can be a negative thing to have a psoriasis flare, but I try my very best to turn it into a positive, or at the very least, teaching moment and advocacy moment. My content definitely started of like fashion, being cute in cute places. And then I had a huge flare on my back, and I turned it into like an artistic photo shoot. I was holding some flowers, and it was very much skin and just like artistic focused. And I got a lot of really great feedback about how powerful that imagery was. And that was kind of what was empowering about sharing my journey with psoriasis in an artistic way, but then sharing more about the rawness and like, this is what happens when I scratch my head and like it snows all over the place, all over my shoulders. So this affects the clothes that I wear, or here's how I do my makeup differently when I'm going through a flare, and giving like tips and tricks of what I've learned along the way, that help me. And also communicating with other people to learn about what works for them and trying that for myself and vice versa. So it's been like really empowering for me for, the community that I've created, and we kind of help each other back and forth. I think you need to have a certain kind of confidence to go out in the world and look like, something's wrong with your face, and you just kind of know that the stigma is out there, and people are unaware of what it is and probably get some kind of idea of what might be going on with you without knowing. So I've had, some questions, some stares, and it's been, that is difficult. So yes, you definitely need to have some kind of confidence to go out in the world like that. But then I kind of bring it back to like, we need to make people more aware of what this is, and that it's not something to be scared of or ashamed of. And I think that's what helps me so much, is that it's like, it's not just my experience, it's other people's experience too, and sharing it helps all of us. As a plus size person, there's already a stigma of why I'm a plus size person, and then add in a skin condition, and the comments that I get are, it's your fault that not only are you plus size, but that you have this skin condition. And there's nothing I could really say to change their minds, because they already have that idea in their heads. But what I can do is respond to that misinformation and share the correct information. And all of our stories are different, and mine is that it is genetic, and it is, from stress is what causes me to flare. And so it's really not helpful to anyone to blame someone for their, chronic genetic disease that they're dealing with. But that's, I think, why the advocacy is so important, to share that psoriasis isn't anyone's fault. And sure, there are different things that you could try, but, a specific diet might work for someone, but it's not going to work for everyone. A specific drug might work for someone, but it's not going to work for everyone. And that's not just because we're all different, but because psoriasis affects us all so different. I'm not the poster child for how to control your stress. That's something that is like an ongoing thing that I'm always working on. I've definitely found some techniques that are helpful, that, therapy, like I'm an advocate for, mental health, well-being, and having a therapist on call when you can, and to not only call on one when you feel like you need it, because there are times where it can be helpful, and you just don't realize like all the things that are piling on. You don't want it to get to that explosive, moment, which is what I tend to do. So do as I say, not as I do on that front. But finding things that relax you and bring you joy and help you unwind. And that can be as easy as like just staring at TV for an hour, watching a movie, or I like to color. Coloring books are kind of mindless for me. And so it's a really nice way to relax. And then doing some deep breathing where you like bring it down to your like your abdomen instead of like chest breathing. That was like a recent one that I just talked to my therapist about, which has been really interesting. And to also feel how it affects my body in a way. Like I can feel like the digestion and like all the things moving, and that has been really helpful. So I've been adding in more like breathing techniques, coloring, and zoning out and letting my brain turn off with some TV. It was a lot of treatments that were like baby level of like, if I didn't have severe psoriasis, maybe this would help me. Like, coal shampoo. I'm like, this does nothing. Some creams that are, off the shelf kind of things. And then eventually onto prescription creams and medications. And again, that was frustrating because sometimes they do help really well, but it's a temporary fix. I remember getting kind of, I think, a steroid injection because my scalp psoriasis was so bad. And it was fantastic for a couple months. Like I would scratch and no flakes. And then, it only lasted for so long. So for about 8 years, I did clinical studies. So I would go in and actually get paid to try the medications, but it also gave me access to try a bunch of different things that were up and coming and get the medication for free. So I was no longer paying for stuff that either didn't work or only worked temporarily. And that was a total game changer for me. I found stuff that worked, I found stuff that didn't, but I'm like, I'm in the same situation that I would be, but like hundreds, if not thousands of dollars in the hole, trying all these things and seeing if they work and hoping that they work. And then recently, there were no more options for me to try. Either I just didn't qualify or they didn't have anything else up and coming for me to hop onto. So at this point in time, I'm on a biologic. And it's one that turns out I did actually try on a clinical study. It worked for me for a few years. So trying to see if it'll help the same way and see how long. And then it's kind of back to the drawing board again, see if there's other clinical studies I can hop on or another medication for me to try. I think there's definitely that initial hesitation of like, oh no, you're like the guinea pig. It's not safe. You need to worry like what kind of things are going to happen to you. But these medications have been through testing, and it's not like this is the beginning level of you're the guinea pig in the lab. It really is right before they hit the market. Like we want to have patient studies to show the efficacy and take the photos or the progress, and how it's more like, so they can be like 90% of patients saw this kind of improvement. So it really is a lot more safe than people might perceive it to be. And then also doing your research in the clinical setting that you're the place that you're going to go is also very helpful. Make sure that they have good client reviews and that people are satisfied with the care that they see there. I would say it's actually some of the best care that I've gotten because they are so hyper fixated on how you're doing with that medication, and you get to go in for, blood tests and things like that. And they've actually caught like, I think I had like a UTI one time or something, and they caught that. And otherwise I would have had no idea. So if anything, it's actually really great care that you receive. It's a little extra money. It's medication you don't have to pay for. And the people that I've worked with have been excellent doctors and excellent staff. So highly recommend. And the bonus is where I go, I get to take my dog. So it's like a really fun experience. Community has been very impactful for me and for my community. It's really the opportunity that you get being online on social media. You get to be in touch with so many other people that you otherwise wouldn't meet in your local area. And psoriasis is actually so much more common than we might think. But you might not know that. Out on the street, you might not see that someone's suffering with psoriasis or that wants to talk to you about psoriasis. So me having a platform where I openly talk about my struggles and what's worked for me, what hasn't, has allowed a lot of people to feel very comfortable being open about their struggles as well. And I hope also getting inspiration or, getting some confidence to talk about their own journey, or even just learning how they could use makeup to make themselves feel confident to go out into the world and not get those stares and comments that they otherwise might receive. So I think it's like really beneficial for me and for other people to have that community, like my little corner of the internet where we can talk about those things. During really big flares, it's very, very painful for a long period of time. Skin is very raw. I had like tearing, bleeding, like taking a shower was painful because, you're trying to get into all your nooks and crannies, and that can involve like stretching of the skin. And then afterwards, it's so drying and really hard to keep my skin calm and comfortable. And so mental health is was the most taxing. Just being in chronic pain for long periods of time was really difficult. And I shared that, and it was helpful to get that off my chest, but then also to have that community be like, I know exactly what you're going through. And they also shared, here's a cream that works for me, just for like that uncomfortable feeling that you're feeling in these certain spots. And it was like a diaper rash cream, and I tried it and I was like, okay, this is a game changer. This actually really helped, what I'm going through. And it didn't solve the problem, but it certainly helped me through those really tough times. So yeah, the physical pain that turns into like a very mental taxing, experience. That's the toughest part for sure. Honestly, the psoriasis diagnosis was intertwined with insulin resistance PCOS diagnosis. So there was like a really long period of time where I was working on health things, getting no answers, trying XYZ, things weren't working, and it was a really long process. And so before that, I don't know that I ever really struggled too much with health, like specifically physical health and chronic diseases and that whole journey. So, being on the other side in a way, or having gone through that for so long, my eyes are open to the struggles of other people, and I've been able to get in touch with other people who have gone through similar things. It's not surprising, but also surprisingly, pretty common that we have all a very similar experience with PCOS, insulin resistance, and psoriasis. A lot of people I've talked to have the same exact issues as me, and going through a very similar experience at the doctor's office, and needing to be an advocate for themselves and learning what the other options are. And yeah, so it's like even when I started my social media, my goal was never to be an advocate for these things, but in talking about them, it just naturally fit. And I'm definitely a much different person that wants to be more outspoken about these things, not only for myself, but for other people dealing with them everywhere. I would say social media has helped me so much, and curating your feed and the people you follow can be so helpful and powerful. So, someone might be going through something similar to you, but maybe they're not talking about it the way that really uplifts you and makes you feel good. And I would say follow people that do make you feel good and make you feel uplifted, and talk about things the way that you want to see them. Like specifically in the plus size space, I don't want to see people like, I need to lose weight, I'm so fat, ugh, I feel gross. That's not the kind of thing that I want to look at. I make sure to follow people who are plus size and find power in creating community that is positive, regardless of what their body looks like. And so transform that in whatever works for you. If you have a skin condition like me, you see someone struggling with it and they make you feel empowered, and they feel powerful, and that inspires you. Follow those types of people, because that really makes a difference. The things that you see every day, the people that you look to for inspiration, it really does, it helps mindset, it makes a difference.